Tooth discolorations. What are they? Where do they come from? And how to identify which ones they are. Because if you know which ones they are, then you know how to treat them. So let's go through a few examples, just kind of showing stains that look similar or discolorations look similar. And then we'll talk about how to start to figure out which ones are which. So right here at this photograph, we can see some dark stuff around the gum line on some of these teeth. What is that? Is that decay or is that tobacco stain? Another slide. We've got some brown spots on some teeth. What about these? Is this from fluorosis or is this from tobacco stain? What about this slide? Which one of these white spots is going to be incipient decay and which one's going to be fluorosis? And lastly, what about these? Teeth all got some chipping along the edge. There's some dark stuff right along the edge of that enamel. Is that just trauma? Is it attrition with exposed dentin? Or is it fluorosis with fractures? You've got to come up with the right diagnosis. You know, in healthcare, they say there's only one true diagnosis, although there may be multiple treatment plan options for that diagnosis. And so getting the diagnosis right is the first thing. And then after that, we can talk about, well, what options are there to treat it? Let's go through and talk about this presentation. It's going to be discolored teeth. It's going to be determining the type and what to do about it. I'm Dr. Brad Revering. I'm a dentist in Flower Mound, Texas. And we're going to go through how to determine what stains or discolorations there are with these teeth. First of all, we're going to just take them and kind of categorize them into two basic camps. We're going to have generalized and we're going to have localized, okay? And this we're talking about not the arrangement of the teeth, but we are talking about the arrangement of teeth, but we are not talking about the shape of the actual lesion or the discoloration itself. So what do I mean by generalized? Generalized means a series of teeth. Typically, the left and right are going to be pretty close, if not mirror images of one another, and involving multiple teeth. Localized, it could just be one spot, or it could be a couple of teeth, or it might be kind of lopsided one side or the other. So that's what we mean by generalized versus localized. Then we're going to divide those two into two other groups, okay? The generalized group is going to be due to external causes, and other ones are going to be from, we'll call them internal causes or developmental issues that developed in the enamel when it was growing. Localized is going to be then broken into two camps, and that's going to be something that happened in the patient's life, and then the other one is going to be something as a result of dental treatment. Okay. So when it's all said and done, this is basically the flow chart that we're going to be coming up with, and this is going to get you close to what the diagnosis is going to be for a vast majority of the discolorations you're going to see that are out there. It's kind of a very simplified way of approaching this topic. So let's go through each one of these branches. Okay, we're going to start with the generalized, things that are from external causes, okay? Namely, just food and drink. You know, we all know that coffee, tea, sodas, red wine, blueberries, all these different things can sit on the teeth and cause them to stain. And that's going to be on the outer layer of the teeth. It's going to depend upon what exactly you're eating or drinking, how often, and for how many years this has been going on. That's all going to play into how entrenched or how deep those stains are going to be, or just, you know, the discolorations. Also, just part of aging, again, how long someone has been consuming these things, or just living, you know, just living life is going to lead to some discolorations. And so how can you prevent this? Well, you just have to reduce the frequency of the consumption of these different foods and drinks, okay? So what is the treatment for it if this is the actual cause? It's going to be obviously a cleaning. Let's get the stuff off the teeth, and then whitening. Placing a carbamide peroxide gel on the teeth is going to be the best way to fix that. Tobacco. That's something else. It's going to be generalized, and it is going to be some kind of external factor. We all know this is just from smoking, and whether it be smoking or smokeless tobacco, either one. The longer the teeth are exposed, the more the stains are going to become entrenched. How do you prevent this? Well, you stop. You just stop tobacco use. It's not good for you generally. Again, cleaning and whitening is going to be the treatment for that. What about just plaque and tartar? Okay, this is just stuff that builds up on the teeth over time. And again, cleaning. However, if it goes too deep, if there's too much of a buildup, it's going below the gum line, it's more than just a regular cleaning. It's actually going to require what's called scaling and root planing. That's where the hygienist is going to go below the gum line to get all that tartar off and really kind of do a deep cleaning to get rid of the plaque that's been building up for years and years. Okay, next category. Again, we're talking about generalized, developmental. This is from internal causes, and let's go through those. Okay, fluorosis is probably the number one thing that we're going to see, at least here in North America, where I'm practicing. Fluorosis is what we see quite routinely. Now, fluoride is a good thing for your teeth for preventing cavities, but too much, like anything, is not good for you. To kind of give you an idea, what we're wanting to do is somewhere around 0.7 parts per million should be the fluoridation level of your water supply. If it's 2 or more, that's going to be too much. But it's not just the water supply. It's also going to be fluoride toothpaste. It's going to be maybe fluoride tablets or fluoride rinses. There's various ways that you can accumulate fluoride into your system. And again, fluoride is good. I definitely think fluoride toothpaste are good. I don't think the fluoride-free ones are bad. There seems to be an idea that fluoride is somehow bad and that it's unnatural, but fluoride is a naturally occurring element, and it's very natural, and it is something that your teeth should be exposed to further lessen your chances of getting cavities. Treatment for this, if it's very superficial, you can use an acid microabrasion, which is just a acidic pumice that the dentist will put on the teeth to kind of get rid of any superficial layers of discoloration. If it's deeper than that, it may require whitening. And if it's very deep, then veneering or putting porcelain over the fronts of the teeth is going to help fix that problem. Tetracycline. This is what happens when a child under the age of 8 consumes tetracycline. During the layering of enamel, when it's being built or when it's being developed, tetracycline has a way of binding inside of that enamel and causing this kind of deep-seated discoloration. It's usually going to be kind of a gray, maybe a brown, and it's going to have horizontal striping is typically what that looks like. And really the only treatment for this is veneers or crowns, putting something porcelain, trying to mask it. Trying to bleach it, it has minor effects. It's never going to get them really, really white or, I think what most people would hope they're going to get from whitening. But placing them or placing veneers or crowns on as a way of blocking that color is really going to be the only way to do that. And then you can just have tooth dysplasia. It's just a generalized term. It just means something didn't go right when the enamel was being formed. Many times this is called amelogenesis imperfecta or dentinogenesis imperfecta. And this can cause from genetics or just a variety of systemic diseases. And it has many different appearances. Again, it's going to be more generalized in appearance across probably the top and bottom teeth. It all is going to come down to just how that either genetic disposition played out during the time of development. The treatment for this, again, depending upon the severity, is going to end up being either veneers or crowns. Okay, let's move on now to the localized camp. Remember, there's generalized and there's localized. We're going to look at localized. And these are events that happen in the patient's life. So let's go to this one. Again, this is tooth dysplasia. Now, I just said tooth dysplasia before, but that was the generalized type. This is going to be more localized. And this is tooth formation that was disrupted due to a problem with the baby tooth that was on top of it. As we all know, adult teeth have got a baby tooth that sits on top of it. If there's a problem with that baby tooth, it's going to affect potentially the underlying adult tooth that's going to take its place. It's usually some kind of trauma that occurred to that baby tooth that then gets transferred to that adult tooth during its formation stage, or it's going to be some kind of infection from the baby tooth. The treatment for this, if it's real small, it can just be a filling. If it gets bigger, we're talking veneers or crowns at that point. Decay, another cavities, same thing. We all kind of know this comes from too much sugar intake. Sugar feeds the bacteria. The bacteria has byproducts, waste products that are acidic, and that's what eats away at the enamel. So advanced stages of the teeth of decay can actually cause the teeth to break away. And this can be done in one tooth or it can be several teeth. It can be almost generalized if they have a whole bunch of teeth, but usually you can spot what's going on because there's going to be actually a hole in the tooth itself. Way to prevent this, of course, just decrease your sugar intake and just improve your home care. Better brushing, flossing, rinsing, and of course, seeing your dentist at least twice a year. Treatment for this, again, filling, crown, veneer. That's kind of, you're going to be 3 options there. A necrotic tooth. Another way of saying a tooth has got a dead nerve, or the pulp tissue inside the tooth is dead. Now, this usually comes from trauma. It can even have happened many years, if not a decade or two previously, to the adult tooth, that it slowly dies away, and then the tooth becomes what we call necrotic. And it gets progressively darker over time. And there's no feeling to this tooth, meaning no feeling to cold. You can press on it and feel it, but if you were to put an ice cube on that tooth, you wouldn't be able to feel it. That means the nerve is dead. What's the treatment for this? It's going to be a root canal. It means we have to clean out that dead tissue inside the tooth. And then afterwards, bleach the tooth from the inside out. and then we put a filling in the back of it, or you put a veneer on the front of it to mask it. Here's another one very similar in appearance to the previous one, but this is due to a calcified canal. That means that the pulp is no longer there, but the little tube, the canal that goes up and down the tooth, has slowly calcified over time, and it's now completely closed off. And as a consequence, the tooth is dark. It usually isn't as dark as a necrotic tooth, but it just seems a little bit different than the other teeth. You cannot root canal this tooth since there is nothing to clean out. You can't really bleach it from the inside out. So the only option there is to do a veneer or a crown. Trying to selectively bleach that one tooth is very difficult to do. So anytime you put bleach on there, it's going to spread across to the other teeth. So to fix this problem is to just put a veneer or a crown on it. And the other one is going to be exposed dentin. So we all have enamel shell covering that goes over our teeth, but if that wears down, the next layer in is called dentin. And dentin can be this kind of yellowish, brown, golden color. And so sometimes that discoloration is nothing more than having the natural dentin shine through because the enamel has become worn away. And the best fix for these really is typically just going to be a filling. In some extreme cases, that might involve a veneer or crown, but a vast majority of them is just going to be a filling to kind of put back the enamel that isn't there. Of course, we have to make sure that whatever we put back is not going to interfere with the bite, but that's how we can kind of get rid of that dark discoloration, is simply covering over the top of it. All right, so now that brings us to discoloration of permanent teeth that is localized due to dental treatment, previous dental work. And this is pretty simple. If you have a filling that's been there for many years, the edge of it might start to pick up stain, or the seal might break and you get some discoloration that way. And really the only fix for that, again, is replace the filling with a different one. If it gets to be too big, again, we keep coming back to the same thing, a veneer or a crown. Or you can have a silver filling that over time kind of corrodes, and that corrosion leaks into the surrounding tooth structure and kind of creates this gray enamel right there. And this, this doesn't really affect the strength of the tooth. It just looks kind of bad when you smile. You have this kind of dark tooth. And so the fix for that is to take out the old silver filling and any of the affected or dark dentin or enamel, and then put a new filling. If it gets to be too big of a hole, then the crown has to be done instead. So again, this is just kind of a quick run through of discoloration of teeth and how at least I categorize them, looking at them being generalized, localized, and then from there's two other branches. And this is going to probably catch about 90–95% of the different discolorations you see that come into the office. And that is it. Hope you enjoyed it. Take care.